Welcome to the webinar Introduction to Sport and In-Shape Prevention plus Wellness Programs. My name is Dr. Chudley Wirch. I'm president and founder at Prevention Plus Wellness, located here in beautiful Jacksonville, Florida. This webinar will last about 25 to 30 minutes. And the objectives of this webinar are threefold. First of all, we'll be describing the features that differentiate prevention plus wellness programs from prevention or health programs. Secondly, we'll list the program and training options that are offered at Prevention Plus Wellness LLC. And then thirdly, we'll explain the key components as well as the outcomes of the evidence-based sport and in-shape prevention plus wellness programs. So first of all, I wanted to talk a little bit about what prevention plus wellness programs are and are not. First of all of our programs are motivational more so than informational. They're designed to be effective and practical tools in motivating youth and adults to improve their lifestyles and change their behaviors, specifically to avoid or to reduce the risky habits like substance use and engage in wellness and fitness behaviors like physical activity. Secondly, our programs are all tailored. They are not generic, and so specifically they're customized to the current health habits of all participants. Thirdly, all prevention plus wellness programs are brief and therefore they're practical. In fact, our sport and in-shape prevention plus wellness programs are a single session, and so they can be implemented in just about any setting, any busy setting where young people are found. Fourthly, all programs by Prevention Plus Wellness are scripted. They're not ambiguous, so everything is laid out. In fact, it is truly a full script or protocol that you can read, which increases the potential for improving the fidelity of the program or implementing it as it was originally designed and shown to be effective. Number 5, Prevention Plus Wellness programs are focused on multi-health issues and problems, not single health issues and problems like typical prevention programs or health programs. So multi-health being, again, they are aimed at preventing substance use, but also addressing physical inactivity, unhealthy eating, lack of sleep, and uncontrolled stress. And lastly, Prevention Plus Wellness programs are that. They're plus wellness and prevention integrated together and versus, again, typical prevention or wellness programs. So PPW programs are very unique in that they literally integrate or connect and show the relationships between the prevention of and avoidance of substance use habits with the promotion of wellness and positive images. To continue, Prevention Plus Wellness programs are positive, not negative. The focus is on positive behaviors, wellness behaviors, as well as positive images of young people, of peers, and of themselves in the future. And that's why it's image-based, not risk-based. Specifically, we use essentially a appealing or positive image approach, much like successful companies use in advertising their products, except the product we are marketing is a wellness lifestyle and avoiding of risk behaviors. So not too much focused on the risk or the harm approach as much as it is a positive youth development approach. Number 9, our Prevention Plus Wellness programs are evidence-based or evidence-informed. So our programs such as Sport and InShape for adolescents and young adults respectively are actually research developed, and we conducted clinical trials of their effectiveness, and the published results are found in very high quality scientific journal articles. And then from there, these programs were listed on evidence-based databases like NREPP, which is the National Registry of Evidence-Based Programs and Practices, as well as other national evidence-based databases and state databases, such as they were reviewed and are included among a handful of effective substance abuse and marijuana prevention programs in the state of Washington. Number 10, all of our prevention plus wellness programs are able to be implemented in two formats, not just a single format. Specifically, they were originally designed to be implemented one-on-one or in sort of a coaching type of a setting, individually implemented, but there's also a protocol in all of our programs to implement them in a group setting. And lastly, once you purchase a prevention plus wellness program, it is fully inclusive. You don't need to purchase anything else. You don't need to purchase more materials for the implementers, for teachers, for parents, for kids, or participants at all, because everything is available in your manual or your digital downloads to implement the program to unlimited numbers of participants over time. There are two theories that underline all prevention plus wellness programs. There is, first of all, a conceptual framework, which is the behavior image model. And then there's a practical application framework, which we call the SFGF model. I'm going to explain both of those just a little bit more right now. First of all, the conceptual model, behavior image model, or BIM. The behavior image model, BIM model, is essentially a theoretical or conceptual roadmap for developing brief, practical programs that connect or link or integrate wellness with substance abuse prevention. Now, there's two components to the BIM model, BIM model. The first is this notion of using natural and highly motivational, positive images that we all have. And so our interventions, our programs, and our tools for professionals and for parents are designed to trigger or cue these positive images that we all have of our peers and of ourselves in the future, engaged in wellness habits or healthy habits. And then we're able to link the risk behaviors, avoidance of risk behaviors to those messages very, very quickly, using, for the most part, appealing image terms, evocative terms, to paint a picture in our mind, which may not even be we may not even be aware of. Much like, again, the advertising campaigns that major companies use. And then once these positive images have been cued, that's the motivational piece. We shift into the action piece, which is giving participants a chance to set multiple behavior goals. In other words, not just to avoid the harmful risk behaviors like substance use, alcohol, tobacco, marijuana, other drug use, but also to increase one or more healthy or wellness or fitness behaviors, which by doing that, by setting goals and monitoring them and achieving them, we are actually teaching participants to increase their self-regulation or self-control skills. Meanwhile, the practice framework, the evidence-based practice framework for all of our PPW programs is the SFGF model. SFGF is a screening and brief intervention model. So screening and brief intervention models are all about motivating behavior and have been found to be extremely effective, and perhaps more effective than any intervention model or format that you can see in the research, with decades of evidence supporting their effectiveness. And this particular model, SFGF, stands for, as you can see, read down the four steps there: screening, feedback, goal setting, and follow-up. The first step is screening individuals for their current health behaviors. That includes both risk behaviors and wellness behaviors. Secondly, provide feedback and wellness image communication. This is where you trigger those positive image by using those image terms and some illustrations of positive illustrations, appealing images of your target population engaged in those wellness behaviors. Thirdly, to set goals to avoid the risk behaviors of substance use and engage in one or more healthy habits, and then eventually follow up with strategies and support. This follow-up could be immediately, or it actually could be a year later. So here's a quick list of the Prevention Plus Wellness programs. We'll be focusing for the rest of the webinar on the first two items, the SPORT Prevention Plus Wellness program, of which there's three versions, three developmental versions. There's one for the older adolescents, ages 14 to 18, that's the high school age. There's a young adolescent version for middle school age kids, ages 10 to 14. And then there's a children's version for the upper elementary age kids, 8 to 10 years of age. There's also the InShape Prevention Plus Wellness program. Both SPORT and InShape are single-session evidence-based programs. We also have evidence-informed programs based in the same conceptual and practices model. Again, based on SPORT and InShape, the SPORT Recovery Program, which is for youth in substance abuse treatment and recovery. There's a SPORT 2 Prevention Plus Wellness program, which is actually two versions, one for older and younger adolescents. And the SPORT 2 program was designed to be a follow-up to the SPORT program. It actually provides 6 additional lessons, again, the same format for implementation and content, screening, feedback, goal setting, targeting of those positive images, linking the risk behavior messages to that. And it's just that the SPORT 2 goes in a little bit more depth into a number of health behaviors. There's 3 lessons on different types of physical activity, moderate and vigorous aerobic and muscle strengthening activity. There's a whole lesson on nutrition, one lesson on weight control, weight management, and a final lesson on stress management. We also have In God's Image program, which is a 3-session program linking physical, mental health promotion along with spiritual development, which is used in faith-based settings. We have a Prevention Plus Wellness adult recovery program for adults in substance abuse treatment and recovery because of the critical need for the development of wellness lifestyles as a part of effective substance abuse recovery. We also have tools for parents. We've got Prevention Plus Wellness for Parents, which is 7 lessons that parents can actually implement to their kids at home. They are the similar or parallel lessons to the SPORT 2, plus the addition of a planning for school success lesson for kids. So this provides parents with, again, the materials to screen their kids for the current health habits, provide tailored feedback, and walk them through setting goals to improve their lifestyle. We also have Prevention Plus Wellness contracts. We have 5 options for the contracts, and specifically, we have contracts for parents and teens to avoid alcohol, tobacco, and drug use problems, for improving school grades and attendance, for avoiding driving citations and accidents, for following house rules, and then a 5th one for practicing living a moral life. So contracts are a common and very helpful tool for communicating behavioral guidelines in the family, and all of our Prevention Plus Wellness contracts are not like other contracts. They, in that they also are designed to promote healthy image development as well as healthy behaviors, along with reducing and preventing these risky behaviors. In addition, we also have parent flyers and parent youth wellness resources, which can be used in the home with parents and guardians with their children. And then we also, lastly, we have training. We have certified training for health and prevention professionals to implement or train others to implement our programs. We have training, youth leadership training for young people that might want to implement our programs, whether they be young adults or adolescents. And then lastly, we have a certified training program for those who want to lead workshops in helping parents develop prevention plus wellness lifestyles among their kids. So there are some similarities between the sport prevention plus wellness and InShape PPW programs. So these are the list of the things that they're similar. They're both single lesson programs. You only need to implement them one time, and they are effective in just single implementation. And that's how they were developed. And they were developed with funding from the National Institutes of Health. Both are considered evidence-based, listed on the National Registry of Evidence-Based Programs and Practices, NREPP, as well as other evidence-based databases. Both are implemented either one-on-one or in a group setting. Both are designed to promote wellness habits and at the same time to prevent and reduce substance use. Both are designed to be used either alone as an independent intervention, or they can be added to other interventions because of their brevity and their practical nature. They can be repeated over time, and in fact, we highly recommend that all young people receive at least an annual inoculation against common health risk behaviors that they experience in our culture, which is again exposure to substance use, as well as physical inactivity, not eating healthy foods, not getting enough sleep, having daily stress. And so by using prevention plus wellness programs like SPORT and InShape, you're able to give kids either individually or in a group an opportunity to reflect on their current health habits, to motivate them by cueing the positive images they have of their peers and of a future self engaged in wellness behaviors, and to set goals to avoid the risky behaviors and to practice a wellness lifestyle. And both SPORT and InShape are inclusive program materials. Everything is included. You don't need to purchase anything else once you order a program. Now, there are some differences in SPORT and InShape. Specifically, SPORT comes in 3 versions, which I've already mentioned, for older adolescents, young adolescents, and children, whereas InShape is for young adults ages 18 to 25 or 26. And SPORT also includes optional parent flyers and parent youth web resources, whereas InShape does not. Here's the SPORT and InShape program manual. These are the components, whether for both InShape and the SPORT manuals. Both these manuals include directions and tips for implementation. They include a self-administered screening survey to assess current health habits of participants, one-on-one and group scripts, protocols to implement the interventions either one-on-one or in a group. PowerPoint slides are included, multiple health behavior goal plans are included, and a number of process and evaluation or outcome evaluation tools are included. All of that is included in these inclusive manuals and, like I said, digital downloads that come with the purchase of SPORT or InShape. Now, SPORT is an evidence-based program that's research developed and tested under rigorous controlled trials or evaluation in real world community settings. And see, this is I should say a summary of the major findings over the studies that we've conducted of the SPORT PPW program. First of all, SPORT as a single lesson program has been shown to influence both substance use behaviors and wellness habits of young and older adolescents. Secondly, SPORT has been shown to prevent and reduce substance use and substance use problems, with some effects lasting up to a year, which is quite amazing given the fact that, again, it's an extremely brief single lesson intervention. Third, SPORT parent flyers alone have been found to influence significantly the substance use among adolescents. So the flyers alone can be very effective by having parents engaged. Fourth, a sport has been shown to impact multiple health behaviors of youth from extremely diverse cultures. Now, most of the research has been done here in the United States, but we had one trial where sport was translated into Turkish language, implemented as a part of a master's thesis in nursing, and in a controlled study, it was shown to improve almost all of the targeted health behaviors for kids that got the one lesson sport program versus the control group. So it shows I think the power and the universality of these images, these youth images that young people have of themselves, again of their peers and of a future desired self engaged in the wellness behaviors. The effect sizes were actually larger for substance-using youth. So, in fact, the effect size were actually ranged all the way up to large effect sizes, which is quite amazing, again, for such a brief program. Communication. So sport is designed as a universal prevention and intervention, meaning it's ideal for all young people because all young people should be getting these important messages and should learn about the connections between engaging in wellness behaviors and how those can help prevent risk behaviors, and how vice versa risk behaviors can actually make it more difficult to engage in a wellness lifestyle. We found that even higher risk kids already engaged in substance use, can actually benefit even more from the sport program. And lastly, adaptations of sport has been programs have been shown to influence other wellness habits, including improving fruits and vegetable consumption, controlling stress, and increasing the amount of sleep that young people get. InShape research has shown that, just as a summary, that the single lesson InShape program influences, again, both substance use and wellness habits. So particularly preventing and reducing alcohol and marijuana consumption, while improving healthy habits like physical activity, healthy eating, and so forth. And InShape has been shown to also improve various types of health-related quality of life. So not just behaviors, but actual quality of life has been shown to improve from the single session InShape program for young adults. And we did one trial of InShape, which shows that it also has potential to be implemented in a computer format. So I want to thank you for listening to this very brief webinar. If you go to our website and you're interested in ordering any of our programs or services, you're welcome to take advantage of this 10% discount as long as it lasts. And you'll be able to tell if it lasts by on checkout. You just put in the discount code word webinar discount. That's one word, webinar discount. And as long as that discount is active, you will get 10% off your total order. Thank you again for joining us for this very brief webinar. If you're interested in learning more about these very practical, brief, evidence-based programs that we have and tools for connecting prevention with wellness, you can go to our website, which is preventionpluswellness.com. We have a whole bunch of resources on there for prevention and health professionals, for substance use recovery professionals, for parents, and we have training and plenty of free resources as well, along with videos and articles and so forth. You can also reach out to us on our email by just sending us a note to info@preventionpluswellness.com, and we are located here in Jacksonville, Florida. Call us anytime of the day or night. Actually, we're quite late because we have programs throughout the country and abroad, and so to be able to serve people on the East and West Coast, we're available long hours of most days. You can reach us at 904-472-5022. Thank you so much for joining us. I know you have a busy schedule, and we really appreciate you taking the time to listen to this webinar. Reach out to us if you have any questions, and if you need any help from us, We're always available, and especially to our customers that make a purchase. Once you make a purchase from us, you can always reach us by email or by phone, because we're dedicated to ensuring you have a successful experience with our programs and our tools when implementing them, and that the kids enjoy them, as well as parents and providers and organizations, and that you do have success with them. Again, thank you. Have a great day.